Aspira Women's Health is dedicated to transforming women's gynecological health, starting with ovarian cancer. And with me is Nicole Sandford, the CEO of Aspira Women's Health, and Dr. Tamika Sea, the founder and owner of Advanced Women's Care Center in Georgia. So great to have you here.
Thank you so much.
So now let's start with Nicole. Tell us about Aspira Women's Health. I know you've been here, but give us an overview and an update.
Sure. Well, Aspira is the only publicly traded company that is exclusively focused on developing new innovative technologies for the diagnosis of gynecologic disease, which is an area of medicine that's been historically underinvested in. We're not a new company. We've been around. Our technology has been tried and tested and clinically studied for quite a while. So we're the only company that can say that, actually. So we're very excited to keep paving the way for gynecologic disease diagnostics.
And you've just announced a clinical advisory board as part of your mission.
Right.
Your company mission. So tell me about the board. Why was this a good time? Who makes up the board?
Yeah, sure. So we've been very fortunate. We've had the support of really forward-thinking clinicians for the whole time that we've been in existence. We decided to formalize the board now. We're at a really important pivot point for the company. We're about to launch our endometriosis test, EndoCheck. So we wanted to formalize that relationship for a few reasons. First of all, just to make sure that we have the right access to the right clinicians as we finalize the intended use and get the momentum behind the test as we launch it. But also to start thinking down the road a little bit, what other diseases can we use this technology for, to better understand in a more formalized way what unmet needs there are still in gynecologic disease. So we were very lucky. We've had a nice long relationship with Dr. Sea. We were very lucky that she joined the board and is part of this great group of clinicians that we put together.
So let's turn it to Dr. Sea. Yes. So you're on the clinical advisory board. Yes. Tell me about that. Why did you think that was an important move?
Well, I thought it was very important to have physicians on board with the Aspira Women's Health team, and Nicole has done an excellent job with putting together this clinical advisory committee. Having physicians on board, having physician buy-in, having physician leadership with the products that Aspira Women's Health provides for the women's health community as far as diagnostics and being able to detect, like Nicole said, in regards to gynecologic conditions that we treat in our offices. This was very important for physicians to have some presence, and I'm so thankful that Aspira Women's Health has decided to move in this direction.
And she mentioned some of the diagnostics, and you've got a non-invasive blood test for early detection of ovarian cancer. So tell us about that.
We actually have a suite of tests. We have a test that is used for initial clinical assessment. So when a woman presents to a doctor with an adnexal mass, which is essentially a pelvic mass, we have a test that they can use whether they're looking for initial assessment or whether they're looking to decide who would do a surgery if they've made a decision to move forward with surgery. Simple blood test, and it will provide really helpful insight about the likelihood that that mass is in fact ovarian cancer. It's the only test suite like this available, clinically available.
Yeah, and Dr. Sea, what are the challenges for a physician in treating a woman with a pelvic mass?
Absolutely. So patients coming in with pelvic pain, just in general, the laundry list as far as the differential diagnosis is expansive. So when the patient comes in with a pelvic mass that's diagnosed via ultrasound or CT or MRI, it's very difficult sometimes to understand exactly what the nature of the pelvic mass is. So utilizing clinical assessment tools like the OvaSuite are super helpful with being able to determine whether or not this patient has something that's clinically significant in regards to, do we need to get them to a GYN oncologist for further evaluation, or are these patients that we can watch and wait, we can determine at a later date whether or not they need to either go for surgical intervention or just monitoring.
And how do you use the OvaSuite in your practice?
Yes, so the OvaSuite is comprised of several different clinical assessment tools. So the Ova1, Ova1 Plus is a tool that's utilized specifically for patients that are potentially undergoing surgical intervention for their mass. They have come in, they have, clinical significant pelvic pain, they're having clinical signs and symptoms of need for surgical intervention. Ova1 Plus, along with Overa, which is another portion of the clinical strata, it allows for us to be able to determine whether or not that patient has a clinically benign lesion and can stick with their general gynecologist and have those surgeries performed in their hometown or performed at, in their home hospital versus having to send them out to a GYN oncologist, which, may not be in their area. So we're talking about sending a patient to a more advanced surgical team in order to, perform the surgeries if there's indeed a potential risk for malignancy.
Okay. How does it affect a woman's health to have ovaries removed?
Absolutely. So this is a very tough thing we as clinicians deal with when we have patients that come in with suspicion for malignancy, or even things as simple as endometriosis, although it's not simple. Patients coming in with advanced stage endometriosis and the need for ovarian removal may be possible. But we worry about those patients, especially if they are not in the clinical age for menopause and we're making them surgically menopausal. So what are we, how are we impacting that patient's life? Well, of course, the vasomotor symptoms are going to be the first thing we worry about. So the hot flashes and the night sweats, the weight gain, and some of the other not so pleasant symptoms that patients will deal with, difficulty with sleep, what have you. But those longer term issues associated with estrogen deficiency, especially in these patients that are not age appropriate for menopause. So osteoporosis increase, risk factors for early onset dementia, Parkinson's disease, early onset cardiovascular disease, heart attack, stroke risk, hypercholesterolemia. So the list goes on and on for these patients that are becoming surgically menopausal, possibly not in a time frame that they normally would have transitioned into menopause naturally.
Right, there's probably some mental
Absolutely,
absolutely.
Issues with anxiety, depression, patients who have, previous diagnosis of things like ADHD, those things actually worsen with the loss of estrogen that supports the brain function.
A lot to think about. So, so Dr. C, tell me about the Ova Watch. How do you use that?
Yes, so Ova Watch is a little bit different than the Ova One Plus and Overa, which is more so for the surgical management for pelvic masses. Ova Watch is truly for that patient where we're doing what we call a watch and wait. They have a pelvic lesion that's been detected. It does not look overtly suspicious and need for surgical management. So these are for patients that we look at whether or not they have any clinical significance for any malignancy that's ruled out. And these are patients that we just kind of watch and wait. These are patients that may potentially are unable to get surgery performed at a specific time. These are patients that may not be good surgical candidates. They have some other, medical comorbidities that prevent them from undergoing surgery at that time. I mean, we live in a very high-paced society. Work is a part of some of the reasons as to why patients choose not to undergo surgery immediately, because of the need for time off and need for coordination with their staff and things like that. So having Ova Watch as a clinical tool for the initial clinical assessment, but also to watch and to see the progression of the ovarian lesion and whether or not it'll eventually turn into something that needs surgical intervention in the future.
Do you have any patients that you can share their examples with us?
Absolutely. I had a patient just last month that had a history of having a hysterectomy with an oophorectomy of the left ovary, and came in with a new pelvic mass that was on her only right ovary that she had left. And this is a young patient of mine that's less than 40, so not in that clinical age for menopause. So undergoing surgical menopause in a case like this patient would be very difficult and concerning as far as those other medical issues and ailments that we discussed earlier. So I performed Ova Watch to determine whether or not this was something that was clinically significant. She did not show evidence of need for immediate surgical intervention, but it was something that I desired to kind of watch and wait and see whether or not it, had any suspicious aspects of it that would eventually, allow for us to potentially need to have a surgical intervention in the future. However, this was a perfect test for this patient because she truly doesn't want to be menopausal, and as her physician at 37 years old, I truly don't want to make her menopausal. So this was a very important clinical tool to use in her care.
Nicole, share your experience with surgical menopause.
Sure. I'm extremely passionate about this issue of surgical menopause and using a better clinical tool to identify not just if the patient should have surgery, but when the patient should have surgery. I myself underwent surgical menopause when I had my ovaries removed. If Ova Watch had been available at that time, I could have waited a year or two potentially and not been worried about the nature of the mass. So now that it's available clinically, I would have had that opportunity. So I'm extremely passionate about it. I think this is a real breakthrough for doctors to be able to make better decisions with their patients that are based on data and information and not based on fear.
Nicole, tell us about the future for Aspira. Where will you go?
Sure. So we're excited that we've launched OvaWatch. We're excited to continue to focus on driving adoption, physician adoption, getting the word out to women and their doctors that this new tool is available. And the rest of this year is really going to be super focused on that and driving the adoption overall, and which will in turn drive revenue and allow us to invest in other disease states as we go forward. And of course, we'll be back in a few short months to talk to you about our new endometriosis test. So that's also a huge focus area for us for the rest of the year.
Okay, looking forward to that. And just
Yes.
finally, Dr. C, what should a woman do, or what should she talk to her doctor about if she does have a pelvic mass?
Absolutely. So first and foremost, patient coming in complaining of pelvic pain, diagnosing the pelvic mass in general will be the first step. So asking for the ultrasound, asking for the radiologic screening to determine why that pelvic pain is there, and if the pelvic mass is identified, then asking more specific questions, telling the physician about their family history and what concerns that they may have, discussing whether or not they want to, undergo surgical approach, or whether or not they desire to have more of a observation or surveillance. All of these things are very important to discuss with your physician early on, so that the two, the patient and the physician can come up with a clinical solution that's best for the patient.
Yeah, okay, great advice. Thank you so much,
Sure.
Dr. Nicole. Thank you for coming by.
Thank you.
Thank you.